Hello and welcome to Psoriasis on YouTube. We cover all things psoriasis on this channel. Be sure to hit the subscribe button and click the notification bell to stay up to date on all things psoriasis. Inverse psoriasis, also known as flexural psoriasis, is a challenging condition characterized by red, shiny, smooth lesions that typically develop in skin folds such as the armpits, groin, under the breasts, and around the genitals. Unlike typical psoriasis, inverse psoriasis lacks the thick, scaly patches commonly associated with the condition. Managing inverse psoriasis requires a tailored approach aimed at reducing inflammation, soothing symptoms, and preventing flare-ups. Here, we delve into the top 3 methods in treating inverse psoriasis. Topical treatments. Topical therapies are often the first line of defense against inverse psoriasis due to their targeted application and minimal systemic side effects. Various medications are available in topical forms, including corticosteroids, calcineurin inhibitors, and vitamin D analogs. Corticosteroids. These anti-inflammatory agents effectively alleviate itching, redness, and inflammation associated with inverse psoriasis. They work by suppressing the immune response in the affected skin areas. However, long-term use of potent corticosteroids may lead to skin thinning and other side effects, making them suitable for short-term and intermittent use under medical supervision. Calcineurin inhibitors. Tacrolimus and pimecrolimus are calcineurin inhibitors that modulate the immune response, thereby reducing inflammation and halting the progression of inverse psoriasis. Unlike corticosteroids, they do not cause skin thinning, making them suitable for long-term use in sensitive areas like the groin and genitalia. Vitamin D analogs. Topical preparations containing synthetic forms of vitamin D, such as calcitriol and calcipotriene, help regulate skin cell growth and differentiation. They inhibit the excessive proliferation of skin cells characteristic of psoriasis while reducing inflammation and scaling. Vitamin D analogs are often used alone or in combination with corticosteroids to enhance efficacy and minimize adverse effects. Phototherapy. Phototherapy, also known as light therapy, involves exposing the skin to ultraviolet UV light under medical supervision. This treatment modality is particularly beneficial for patients with widespread or refractory inverse psoriasis who have not responded adequately to topical therapies. Phototherapy works by suppressing the hyperactive immune response in the skin, thereby improving symptoms and promoting remission. Narrowband UVB phototherapy is the most commonly utilized form of phototherapy for inverse psoriasis. It involves exposure to a specific wavelength of UVB light, which penetrates the skin and suppresses inflammation without causing excessive sunburn or DNA damage. NB-UVB phototherapy sessions are typically administered 2 to 3 times per week in a clinic or hospital setting, with gradual increments in dosage to minimize the risk of burns and other adverse effects. Systemic medications. For severe or refractory cases of inverse psoriasis that do not respond adequately to topical treatments or phototherapy, systemic medications may be prescribed to target the underlying immune dysfunction. These medications exert their effects throughout the body, thereby modulating the systemic immune response and reducing inflammation in the skin. Biologic agents. Biologic therapies, such as tumor necrosis factor alpha, TNF-alpha inhibitors, interleukin, IL-17 inhibitors, and IL-23 inhibitors, have revolutionized the treatment of moderate to severe psoriasis, including the inverse variant. These drugs target specific molecules involved in the inflammatory cascade, thereby interrupting the disease process and promoting clearance of psoriatic lesions. Biologics are typically administered via subcutaneous injections or intravenous infusions and require regular monitoring for safety and efficacy. Conventional systemic agents. Methotrexate, cyclosporine, and acitretin are conventional systemic medications that may be considered for severe cases of inverse psoriasis. These drugs modulate the immune system and inhibit the proliferation of skin cells, thereby reducing inflammation and improving symptoms. However, they carry a higher risk of systemic side effects and require regular monitoring of blood parameters to prevent complications. Managing inverse psoriasis requires a multifaceted approach tailored to the individual patient's needs and disease severity. While topical treatments remain the cornerstone of therapy for mild to moderate cases, phototherapy and systemic medications play a crucial role in achieving disease control and improving quality of life for patients with more severe or refractory disease. By leveraging these top 3 methods in treating inverse psoriasis, healthcare providers can effectively alleviate symptoms, prevent flare-ups, and optimize long-term outcomes for affected individuals. If you found this video helpful, give it a thumbs up and share it with others who might benefit from this information. Thanks for watching. Don't forget to subscribe to keep up on all things psoriasis. Take care and be well.